Hello and welcome to the final video for Unit 5, Mental and Physical Health. This video is going to focus on biomedical therapies, and by the end of this video, you should be able to answer the following question. What are the characteristics of psychoactive medications and surgical or invasive interventions? Let's first start with what biomedical therapies are. These are treatments that use medical procedures or medications to help people with psychological disorders. These approaches focus on the brain's biology, such as neurotransmitter activity and brain structures, to reduce symptoms of mental illness. Psychopharmacology is the study of drug effects on the mind and behavior, and this is a key part of biomedical therapy. There are four major types of psychiatric medications. The first is antipsychotic drugs, and these are used to treat schizophrenia and other severe thought disorders by reducing dopamine activity. For example, thorazine and clozapine. The next is anti-anxiety drugs. These help relieve anxiety and agitation by depressing the central nervous system. Some examples are Xanax and Valium. Next is antidepressant drugs, and these increase serotonin or norepinephrine levels to treat depression and anxiety. Most common examples are Prozac, Zoloft, and Paxil. And finally, we have mood-stabilizing drugs, and these are used for bipolar disorder to regulate mood swings. An example is lithium. Other biomedical treatments include electroconvulsive therapy for severe depression, deep brain stimulation, and psychosurgery, which is rarely used today. These therapies are often combined with psychotherapy for the best results. Let's first start with psychoactive medications. These are drugs that affect the central nervous system and alter mood, perception, and behavior. These medications are designed to manage various psychological disorders by influencing neurotransmitter activity in the brain. Psychoactive medications work by modifying the activity of neurotransmitters, chemicals that transmit those signals between the nerve cells. By adjusting neurotransmitter levels or receptor activity, these drugs can alleviate symptoms of mental health disorders. Antipsychotic medications primarily target dopamine receptors to reduce symptoms of psychosis. Some antipsychotics also affect serotonin receptors. One possible side effect, however, is tardive dyskinesia, and this is a potential side effect of long-term use of antipsychotic medications, particularly first-generation antipsychotics. It's characterized by repetitive, involuntary movements such as grimacing, lip smacking, and tongue movements. Antidepressants are a class of psychoactive medications used to treat depression and, in some cases, anxiety disorders. They primarily work by altering the levels of neurotransmitters in the brain, such as serotonin, norepinephrine, and dopamine. One of the most common antidepressants are SSRIs, or selective serotonin reuptake inhibitors. We talked about these back in our biological unit, but this is the idea where reuptake of the excess serotonin is blocked. So the serotonin is left in the synapse to be absorbed by the receiving neuron. Anti-anxiety drugs are used to manage symptoms of anxiety disorders. They often work by enhancing the effects of neurotransmitters that have calming effects on the brain, such as GABA. Lithium and mood-stabilizing drugs are primarily used to manage mood disorders and psychotic symptoms. The mechanism for lithium is modulating neurotransmitter activity, particularly affecting serotonin and norepinephrine systems. This helps stabilize mood swings in bipolar disorder. Next, let's talk about surgical interventions. First is psychosurgery. This involves surgical procedures aimed at altering brain function to treat severe mental disorders. This approach is based on the understanding that certain mental health conditions may be associated with abnormal brain activity or structural abnormalities. Psychosurgery is typically considered when other treatments have failed and the condition is debilitating. An example of psychosurgery is HM, having his hippocampus removed to prevent seizures. The next type of biomedical treatment is transcranial magnetic stimulation, or TMS. This is a non-invasive technique that uses magnetic fields to stimulate nerve cells in the brain. By applying magnetic pulses to specific brain regions, TMS modulates neuron activity and is used primarily to treat depression, especially when traditional treatments are ineffective. TMS is used to treat patients with major depression who have not responded to antidepressant medications. Clinical studies have demonstrated its efficacy in reducing depressive symptoms and improving overall functioning in these patients. Similarly, electroconvulsive therapy, or ECT, involves the application of electrical currents to the brain to reduce controlled seizures. This intervention is typically used for severe cases of depression, bipolar disorder, and schizophrenia when other treatments have been ineffective. ECT is believed to work by altering brain chemistry and neural networks. ECT is often used as a last resort treatment for individuals with severe treatment-resistant depression who have not responded to other forms of therapy, such as medications or psychotherapy. So the difference between TMS and ECT is the type of stimulation that's applied. TMS uses magnetic stimulation, where ECT uses electrical currents. Finally, we have the lobotomy. The lobotomy involves severing connections in the brain's prefrontal cortex to alter behavior and reduce symptoms of severe mental disorders. Historically, this was used to treat conditions like schizophrenia and severe depression. However, it has largely been discontinued due to its significant side effects and ethical concerns. The use of lobotomy has been largely replaced by more effective and less invasive treatments. It is now considered a controversial practice with significant ethical and clinical concerns, and its use is largely a historical reference in the evolution of psychiatric treatment. So it's no longer really used to this day.